The Board of Health meeting held, an emergency meeting held on the 2nd of December at 1:35 in the afternoon for a discussion on the COVID status of the county and discussion of the way forward. At present, our Dave Prince, board member, Tom Flower, board member, Bill Cannon, board member, and Dr. Clifford Brown, the director of the Public Health Agency, Custer County, as well as the OEM director, Adrian Washington, working the software is Vernon Raw. Okay, this meeting will come to order. So let's just get down to the report. Dr. Brown, why don't you let us know what's going on and what thoughts are our way forward in the session.
Yes, in the less than 24 hours, we have had the results come back from the laboratories, from the state laboratories. We have now had at least 23 positive cases during that time. And this is a significant change from where we have been historically.
23 total now, not just in the last.
No, I'm talking about.
Just to clarify what you said.
Right. Yeah, it's not total from February.
Yeah, just so we're clear, I heard you say in the last 24 hours,
Yeah.
we've had 23 positive cases.
Yeah, we had, yes.
Yeah, so they had 23 new cases in the last 24 hours.
Yes, sir.
Okay, that's what I wanted to hear.
So, with that in mind, I did not feel comfortable without having you guys involved in some decision making here, so I can hear what you want to do. But my advice is that we seriously consider not only the businesses involved, but also the people's health involved in the health of our whole county. Okay. So I'm not at this time convinced that we are having, just a terrible outbreak and we're having people die. It's not that type of thing. But we do have positives, and lots of them, in a fairly short period of time in a fairly non-populous, county. And sooner or later, we're going to have somebody who becomes seriously ill. We have had one person back in October that this was the case. We had one person back in February that this was the case. So obviously that's not a large number, but the point is that we have that potential that could be really, really serious for some people. So I wanted to at least sit down and have a discussion with you gentlemen. I am going to, I've already started making a phone call. I'm going to be meeting with the people that I trust in virology and environmental medicine and so on. That all occurs tomorrow, virtually. So they will give me some indication. I obviously don't want to do damage to businesses, but I also don't want to do damages that are permanent to people's health.
Can I interject here, sir?
Sure.
You said that you wanted to sit down and talk with us. Well, you are not the one that started this whole momentum about having a meeting today. I was.
Yes, you
I am the one that reached out and said, I believe we have to have a meeting today. I did not hear that from anyone else in this county.
Okay.
So let's make sure the record's clear. I wanted to have a meeting to decide what the hell we're going to do about this outbreak. And I disagree with your statement that you don't think that's a lot of numbers. 23 positive cases in less than 1 day is a hell of a lot of numbers. I asked this board 2 weeks ago to pick a threshold number that we could all decide on that was going to be kind of the trigger for moving forward. I got no traction in that, none whatsoever. I would have said if we had 3 cases in 1 day, it should have been a trigger point. But gentlemen, didn't get any comments or response from either one of you about that. Now we got 23 cases in 1 day. We are in an outbreak, and clearly it's not going to get any better in the near future, in my opinion. We went from 7 to 23. I thought 7 in 1 day was a lot.
Okay. continue.
Okay, thank you. So I don't do very well at predicting the future, but what I'm watching right now is a trend. And the trend is obviously not getting less. The reason that I had hesitated to push this forward was that I know that there are a lot of people who started listening to the TV, started listening to all of the warnings that are put on the media and saying, you know, we're going to have tremendous problems over Thanksgiving. And they came in, like lots and lots of people came in and started getting tested. A number of these that I've spoken to directly have said, well, yeah, I had symptoms back in October, September, you know, early November or something. And I didn't think too much about it. It just kind of went away, and they came in and then got tested. And of course, the immune system responded. That's what we measure. And so they had the responses showing, and that triggers off the test to show them positive. Okay? So I was pushing for just waiting until this week was over and to see if that bulge relative to Thanksgiving actually occurred. I don't know that yet. And that's why, once again, I've remained fairly silent, just been dealing with people and questioning them to see what kind of risk we have. So, on that basis, and dealing with Mr. Flower this morning by email, questioning back and forth, he was concerned, I was concerned, and I have no problem.
Well, we are all concerned on it.
Yeah,
all on that email.
Right, exactly. So anyway, that's when Mr. Flower suggested that he thinks that he would like to have a meeting on Friday. I said, sure, you know, whatever we can, but I would like to be able to set up at least a procedure for response today, because I'm going to have a meeting with my expert people tomorrow. And
so the meeting on Friday, at what time? We had tossed around, it was 9, 1, I've seen different times. What are you proposing?
I'm just literally following whatever you guys decide.
Yeah, I threw out the suggestion of Friday. I'm assuming this meeting supersedes what I was thinking about on Friday, which I'm tickled to have it today. I just didn't think we could pull it off and get it today, so that's why I said Friday.
The difference is we can't, he hasn't had a chance to get hold of anybody, or other than just us.
So I corresponded with Dr. Brown this morning, and it was a question basically based on these new numbers. Is your recommendation that we go to, and if I'm saying this wrong, is your recommendation that you feel we ought to consider going to level 3? This is in your back, or it was phone call, and we feel we almost have to. So are you making a recommendation that we go to level 3 immediately?
I'm definitely recommending that you guys consider that immediately. Okay?
So, I hate to keep interrupting, and I'm sorry. This whole thing of we move to red, the world I live in, we don't have a damn thing to say about moving to red. The state has already moved us to the red category, is what I understand. Now, I'd like to have a conversation to come to agreement how this happened.
According to the email website that I looked at 30 minutes before we walked in here, they have us at all.
There are 4 counties in the state that are not in the red. So I don't know.
Let me respond to it. You've been pretty vocal, and I'm going to get vocal too.
Help yourself.
The facts are, it's a recommendation. We are, and they told him and me both many
Who
times.
told you that?
The state, it was L initially. I can't remember her last name. The bottom line is, we're in charge of the county government, and we can take recommendations or not, depending on the numbers that we see and the risk versus the benefit. And we just don't jump because the state says jump.
Oh, we
never
might.
have, no.
Yes, we might, if we
We
decide
can
to.
if we decide
Thank
to,
you.
Tom, that's the whole point. We
You
have
don't
to
say
decide.
you don't jump, you will decide whether we jump
That's
or not.
exactly right.
You can't throw out.
You threw out, oh, damn, we're gonna go to red because the state says, by damn, they made us red.
No.
That is not how it
Well, I
works.
did not say that. I said the state has moved us to red.
They had recommended, they didn't, but they moved us in their analysis, they said we need to consider that. They didn't say it was mandatory, because the numbers matter on what's actually happening on the ground. And that's what his job is to make a recommendation based on that. And I happen to agree that it is a significant amount of changes that warrant us to have that discussion and decide whether we're gonna do it. Not that the state decided to tell us to do it. That's the only point I'm trying to make.
I disagree completely.
Okay, you can, and I disagree too. That's okay.
I think we sit down here in Custer County with this attitude, we'll decide what we're gonna do. And I think that is a fallacy. I don't think that is
Okay,
accurate.
that's your opinion.
Yes, it is.
And it's my opinion that, yes, we do. It's our job to decide. Good. And do it with the right intentions and the right, and be responsible with that. And I happen to agree it's responsible to move to a more cautious posture. But I want to hear the options of what that posture really is. I want to have Dr. Brown tell us with a team. That's why he has a team of resources to work what the issues are here on the ground compared to even the other counties that are either ignoring or implementing it correctly. Because I'll tell you, I don't want to cause a panic in this county any more than you do. Well, that may be because everybody's seeing everybody red. That's true. But anyway, what is your recommendation, Dr. Brown? What you said the procedure? How do you recommend doing that?
I would recommend that we, over the next 24 hours, 48 hours, I don't, it doesn't make a lot of difference to any of us, but because it's not going to change.
You turned on. There.
It's not going I'm glad our windows are still intact. No, it is not going to change our next week of reporting of new cases because those people are pretty well have already been tested. Okay, so we're just waiting for the results from those tests. It will give us more information in that time, but my recommendation right now, we must in some way let people know that this is serious. It's not something we can kind of play with. It's not something we can just kind of kick down the road someplace. But those people who do not take it seriously, I think need to have some kind of a wake-up call.
That's the discussion I want to have. What are you recommending? Because if say we're red, we go to red and not do anything about it. We need to know how to let the public know, the business owners, the impacts, what you can't do, what is possible. Because if it's red and everybody hides, who's manning the grocery stores and how are they manned? Or who's pumping gas?
And those functional services have to be kept intact. However, it does directly impact any kind of group meeting except religious services. And that affects very strictly our businesses downtown and our restaurants.
Yeah.
Particularly the restaurants, because then people pull off the mask. So my concerns, I don't want to shut them down, but I do want to have people safe. So our only options that, and you correct me if I'm wrong, I'm sure you will, the only options that I see right now is outside or takeout type of eating for the restaurant. Now, is anybody going to sit out in sub-zero weather eating? No. So that is restriction, and people already are self-restricting because they're afraid. I think that's a reasonable assumption.
Well,
go ahead.
again, just a response. we have these groups meeting, certainly above the numbers recommended by the CDT
Yes, sir.
in restaurants, in these grills, bars. So I don't see that they're afraid to go in there.
Well, that was before we were inundated with new cases.
True, which is,
And we also had a restaurateur who ended up with COVID. And so that, I think, these things are all making impact. I think that's, this is just my opinion, why so many people are coming in to get tested, because they're finally saying this is real, and it's even here with us.
Well, I have understood that also, that people have been self-restricting themselves because they're not, the businesses have been impacted. That I have seen in research. And that's true, but they need to understand then, what's one thing to self-do, it's another thing to have an understanding what we expect of them. Go ahead, Ben.
All well and good. However, without enforcement, we're blowing the whistle. That's my opinion. I mean, you walk into someone like bootleggers or Willie's, they're packed. Nobody's wearing a mask serving. And I hear this all the time, people complaining to me. Yeah, you heard it also. And it's true. I mean, it's not just a complaint. I walked and looked myself. I walked past bootleggers, the place packed, the bars sitting like this. Nobody's serving for it, and I'm not picking on bootleggers. It's just, that's the one that I happen to know. Tell me they don't know what's going on with COVID, because they do. They just didn't care. And I don't think without having some kind of significant penalty of some sort, people are not going to comply. That's my opinion. So when we went to, what's the next one? Purple, and after that is, I guess, black, because that's what you did.
Right.
Okay, but whatever the color is.
Right.
Without some kind of enforcement, I think we're shooting in the head. I mean, I'm sorry to say that, but I've talked about this from day one, I've talked about it from joining us, and I'm still there. As much as I appreciate what you're saying, people need to wake up and be responsible for themselves. And you and I have had this conversation, and I agree with you. Adults ought to be able to say, darn it, I'm going to have to be responsible. This is what I'm going to have to do, and it costs my business money. Too bad we're in such an unusual circumstance. And if a business has to close, or a restaurant has to close because they can't support themselves, I'm very sorry, but that's how life works. You know, it just happens. Nobody did it on purpose. But we need to do something to make sure that people comply with this. If not, I'm telling you, I'm willing to go home and lock myself in my house. I really am. And have our meetings Friday by Zoom or whatever. I mean,
Okay.
we've got it running around this building.
Good point. So let's get to that point. What does red mean? If it means takeout, fine, it's wintertime, that's something different. So then we start talking about how to enforce them. So what does it mean to the county and all the businesses and the people at home when we say that?
You ask what the restrictions are.
Yeah, I want to know what it is. The public needs to know, and we need to understand what we're proposing to do, and what the penalties may be if they don't, or whether we make it mandatory, or whether it's a recommendation like the state has. It's been a recommendation. It's not a mandate. It's not a law. So let's talk about it.
Don't make those kind of statements because they're not true.
It's not a legislative law. It's not an executive order either. It was a recommendation from the governor.
You have read the statute.
I read it.
When the governor has declared an emergency, and puts out an executive order, it is a law. It is a punishable by up to a year in jail, $10,000 fine.
True.
That is a
True,
law.
but is that law, well, the way he stated was, the law says it's recommended that you. It didn't say you will do this and here's the penalty that the county will enforce. It did not. Anyway, that's up to us, and that's why I want to talk about it. So,
Anyway, the red,
tell me what red is.
the red does shut down any type of in-seating, like indoor dining. And that's probably the most, stark difference, contrast between blue, green, yellow, orange.
You just
As soon as
said
you go into red,
restaurants is what you just said.
yeah, indoor dining.
Okay, now talk about the other indoor activities because they are constrained as well.
Yes, they are. So as far as group meetings, essentially of any kind, like I said, except for religious organizations, because that has been challenged in court successfully. But not here, so I don't know why, I'm not a lawyer, but that seems to be the limitation, the restrictions is on religious activities, but not just general religious activities, not banquets, not dining-ins and military, whatever it is. It rarely
Church
is
services.
church services.
Okay.
Yes, sir.
All right.
Those are the big ones. Those are the actual, where you put a wall there you cannot pass.
How does it impact the grocery stores and the gas stations that are different
Grocery
than what
store.
it was at Orange?
Okay, grocery stores have to remain open, but people have to be masked. And once again, to Jay's point, we have to be able to enforce.
Should we enforce a N95 mask, or is it any
That's
mask, or
over
is it just sneezing into your elbow?
Yeah, that's not what the governor says. I would like to, because it's available to everybody. But I've talked to some of the people in the supermarket, grocery store, and people just toss. So I'm not willing to give them a mask of this quality, which is tough to get a hold of for even lunch of surgery centers. I'm not willing to hand out just blatant.
So from our county point of view,
From a county point of view, they have to have some kind of a cloth covering for their face.
cloth covering would include a surgical mask.
Yes, anything from there out. Yes, sir.
I just printed off 4 copies of the dial. So besides the restaurants, I think the other huge impact on moving to red is the limitation on the number of people in an office. That specifically pertains to the county businesses as well as others. We have never talked about that. We should have been at 25% capacity in these offices. We've never even considered it, never even talked about it. Now, if we go to red, it's 10%.
So let's follow that thread. So 10% is of the footprint of what the office that business is done in, or the building itself, or how do you?
Well, capacity, each room, I think legally, correct me if I'm wrong, Jay, is there not a specific capacity that's assigned to each? Okay. So it comes down to that as a
So the guideline inside that capacity would be
10% of that capacity.
10% in each office room, like this room right here.
Right.
10%. The capacity here is, how do you know what the capacity is? How would you calculate that?
I don't know, I'm sure that the capacity is the fire marshal.
Is it a fire marshal has this room footprint in it, so it'd be 10% of that.
See, and I look at it differently. I think if 6 people work in an office, then that's what these numbers are directed at. I don't think it's how many people can stay in here. If there's 5 people that work in human services, and they should have been at 25%, then there should have been 1 or 2 people working in there.
I don't know, that's probably debatable because, depends.
Depends on the
Because the safety, it's about safety from a medical point of view.
and fire.
But the fire is going to be taken care of. There's going to be less people than was in there normally. Normally, it's less capacity than what that room is designed for from a capacity point of view. But even if it was, let's say you could put 100 people in here and the fire marshal says that's okay. Well, it's not okay from a medical point of view. And so that's my point. Is what is the maximum? You'd like to have the maximum possible given and keep it meeting at 25%.
Or how many employees we have in the county? 88?
Yeah.
90? Take 25% of that number, that's how many people that work for the county at any given time.
Well,
Except,
not an office.
that's right, except that
That's the problem. We have to look at
a
the office.
third of them are on a motor grader.
I look at it, as I indicated, I think if we were to follow this level red, says 10% capacity in the offices. So 10% remote work is strongly encouraged.
Right.
As long as they have computers to do that.
Like we have, sure. I'm just really frustrated about
Except for the business.
the things we've talked about all along. We are under governor's orders, but it doesn't have any teeth in it because there's no legislative dictum about enforcement. I think we all know and understand and agree to that. That's where part of my frustration lies.
The modification for me, John, is whether or not the people are wearing a legitimate mask to protect themselves and protect others. If they are wearing a mask, not just sometimes, not wearing their desk until they walk or something, but when they're in an office with other people, if they are not wearing a mask, that violates, I think, what we decided here at the courthouse. And I talked to people, and I won't name names, but I talked to people today. They said, no, we don't have the mask on it unless we get up to go out of the office. Okay, that's not what I understood that we told people to do, and I understood that the kind of supervisors had been divvied up between the three of you, that you're going to talk to these people, and they were going to then dispense the information. Apparently that didn't happen. See, it may have happened some places, but it certainly is not.
It happened, and even on the door it says wear a mask.
I think what Clint's saying is we have employees that are in their office not wearing masks.
That's exactly what I'm trying to say. So if you walk up to somebody and lean over their shoulder and say, what about this? Obviously, that's not a good situation.
Even if they're by themselves, I'm sorry, Tim. If they're by themselves, they're going to sit there with a mask on.
If they're enclosed off,
I'm just asking them.
if they're enclosed in a private office, they don't have to have a mask on. You know, that's just part of it. They're the only person in the office. But if they get up and get out of their office or go over and talk to somebody, that's when you're putting other people
It
at
just
risk.
makes sense because you're getting closer than 12 feet or whatever.
So,
Yes, sir.
Go ahead, please.
what concerns me is, this isn't a new thing. I mean, masks, wear a mask, wear a mask, we've heard this for months and months now. If we go from orange to red, is it going to change a single person's mind? I mean, it's one thing, but the people who are going to go, I'm not wearing a mask, how dare the government tell me what to do, I'm going to do whatever I want. Or vice versa.
Right.
Okay? If I go on the red, is that going to do anything other than harm the restaurants further? I mean, you and I talked about personal responsibility multiple times, that, you know what, adults sort of look at the facts and make their own decisions. However, we as government have to tell them what they need to be doing, and then they can make that decision. So, I mean, I feel like we're
Spinning wheels.
throwing snowballs in the sky.
Into a fire.
Yeah, whatever. I mean, we could go directly to purple. What's the difference? Either you're going to adhere to it or not. So, I'm frustrated, but for a different reason. Because people are just not willing to understand the severity of this thing and how I believe in the science. And I believe the science, the best thing we have at the moment till the vaccines get out is distance and mask. I believe that, and wash your hands before you fit in my mask. I really appreciated that you went and washed your hands first. I really appreciate. I said, there's a man who's following the rules, and I appreciate that. But you're an exception. I don't want to say exception. Not everybody's doing what you're doing. Let me put it that way. So go into a different color. I don't think that's going to make it.
Well, I agree with you, David. Make one comment on it. The problem is, you can tell people that they need to be aware that they should wash their hands, wear a mask, and why. Because ignorance in this case of the law is a problem because it impacts you and me. And so that's the problem is to say we're going to go to red and then start fining people. You have to have them wanting to do it. It's not that they're gonna be told to do it and then have them comply. Otherwise, I mean, you can see what happens to the people that are just extremely, anti anything. You know, if they understand the impact, like, I'm not the enemy here. You know, I have a wife that has a problem and I wanna help protect her. I wanna protect you, Jenny, or you, Clint. And respect that and respect the distances as long as we know the impacts. And that's what's important for your agency, our agency, to be doing. And that's making sure people are aware. And of course, we're going to be better for it when we get a public information professional in there that is on top of making sure people understand the decisions we're making and why we're making those decisions. Okay, so what are the other implications before we, like the gas stations? Those are, people make complain about gas stations.
Yeah.
And you put a rubber glove out there, people throw them on the ground.
We, by the way, on Monday actually received finally our rubber gloves and the purifier for the gas stations.
Well, wouldn't the recommendation be to have people have their own gloves? Like, the reason why I can't put my own gloves on, I don't need gas station.
Right. That's right.
I know the impact.
And I think there's.
So what is the actual medical impact of having the bug on the pumps out there?
Because you end up touching.
No, I know. How long does it last? Is it something? You have to understand that it isn't gone necessarily.
And of course, the answer to that question depends on how much moisture is involved, so how long it lives. And
Right.
so, and we agreed to at least give people an option when you go up to the gas pump to be able to stick a glove on, and be able to take the glove off, wash it, whatever, so that you are protected. And we agreed to at least make that an option available, just like the mask.
Just like the grocery stores.
Just like the grocery store.
Give to people rather than
Exactly.
letting them stop in just because they don't have a mask.
Yes, sir.
So how would we go about doing that? What's your thoughts?
I don't know, without a court order, how you're going to force anybody, and the court order just takes you to court, and then everything goes up how the judge decides.
But my point, why wouldn't the business owner, like the Lowe's grocery store manager, say, here, don't let people in if they come in without a mask, and oh, by the way, here's one for you. Ace does that.
I know that they were offering masks to anybody who walked in at Lowe's too. That's what I was told.
I haven't seen it.
Yeah, but that's what they told me. Okay, when I asked, is that something you guys have not seen or know of or heard of or whatever? Because when I asked, that's what I was.
I have not seen anybody offering on that. Anybody.
We also have that section of the population that says, well, I have to do that. And without some kind of.
Yeah, you're right. I've been to many states during this pandemic, and I've seen Home Depots turning people away unless they had a mask. And then I've seen other Home Depots offering them a mask in lieu of it. It just depends. But that's something that the state offers as an option, and that's something we as a county can ask as an option as well. I would think that's something to consider. Makes sense.
So we've used up 1 or 4 boxes, and I've given.
I'm not suggesting we buy related masks. That would be up to me. It would be the store owner's responsibility to make sure their business continues.
Well, as I see it, the biggest impacts if we implement the guidelines under the red category clearly is going to be the restaurants and the offices.
Right.
The political realm in Denver has decided that the schools, which in my opinion is the biggest incubator in the county, don't have to deal with this red like restaurants and offices do. And I think they just get to the political pressure of our kids need to be in school. So hybrid or remote is suggested for red they just went back to school the day before yesterday. So, same thing with churches, that political, nobody wants that political hot potato, so they've left them the same. If they don't mind, for all intents and purposes, shutting down these restaurants.
Even 10% on churches, not shutting it down.
Well, churches aren't 10%.
I mean, that's going to be related 10%.
Yeah, so the enforcement, if you guys are going to, the Board of Health and County Commissioners, if you're going to decide to approach the judge, the county judges, and get some kind of an indication from them what they were willing to do, is that, I don't know. I don't know the law in that aspect as far as enforcement.
I would recommend that we not have a conversation on enforcement unless you talk to the sheriff's office. Because without an enforcing agency, you're not going to have any enforcement.
Well, we've gone down this for the last 7 months, right? According to state statute, the public health agency can issue citations.
Right.
They don't have to have the sheriff's office. We've gone around and around about this. I know this was pre you guys coming on. Our former public health director had a citation book from the sheriff's department. She was prepared and directed to write tickets for violations.
But in order, and I hear what you said, Tom, but in order to do that, you have to be properly trained. You can't just,
according to state statute.
having a ticket book does not enable a person to go and write tickets.
Well, I disagree. It does legally. We sure weren't going to send her out on her own to do that, Adrian. No way. She was going to have a deputy go with her if that was the case. But
The Director of Public Health has the authority.
The Director of Public Health has the authority. Most state departments have the authority to write citations and tickets. Yet the people who write those tickets are properly trained in how to write a ticket. You just don't grab a ticket book, because we're opening our employees up to physical abuse and other things. So I'm not saying you cannot do
Two
that.
things you brought up there, and I'm going to agree with one and disagree with the other. One is, you're right, anybody walks in and says, I'm writing you a ticket because you're not complying, you have opened yourself up to abuse. No doubt whatsoever. Filling out a ticket book is so simple. I mean, it's check the box, fill in the number, sign it, and you're done. I mean, it's really 5 minutes. Anybody in this room would know how to fill it out properly, where a judge can say it's a proper citation. Now, what the judge does is the judge's business. And that's always been the difference between, the 3 levels of government. I don't mean to get into a civics class here, but the enforcement, writing the ticket, and the adjudication are 2 separate things. Whether the judge accepts it or not, irrespective of whether you issue the citation or not. That's my opinion. That's actually.
I think the other thing that moving to red could have a big implementation on are these camps. I have no idea what the camps are doing now. I don't know if you've talked to them. Have they limited 25% under yellow, or are they operating as normal?
I think they moved out of state. And one of them.
The ranch has not allowed people to be even getting food at the same time with anybody outside of their family unit. And they are, if they have a camp, they are spacing, this is from the other thing, they are spacing people out if they even allow 2 different families in the same room, period. So they have really, from everything that has been indicated to me, have been over backwards to not have people in contact with each other. Does that stop the camp workers from coming in contact with somebody who comes in from somewhere and infects them? No, it doesn't stop that at all. We can slow it way down with proper use of masks, but it doesn't guarantee anything. If one of them gets sick and they go in a car ride for hours together, everybody else is going to get sick in that car. But that's not obviously the camp itself. So they have restricted themselves, at least the camp that I'm aware of directly, has restricted itself to very over an abundance of social distancing, not putting people together, and cleaning things down once the people have been in there. I guess that answers your question.
So if we step back from the minutia and look at the big picture, 23 positive cases in one day. I don't think any of us are going to be qualified to say why that happened. But we do know some things for sure. It happened in spite of our efforts to get people to wear a mask, to get people to social distance, and to get people to try to follow the guidelines, which I'm not sure we've done a very good job on that.
May I say something on the statistic, please?
Go ahead.
The 23 positive cases, the results of the testing came back in one day. That does not mean that we had, it was one day over a period of a week, probably 10 days of the test results being in the lab, and that the results came back that we had 23 positives on a given day.
Right.
But the impact of folks being, let's say, compromised happened over a period of a longer period of time. So we have to be careful. The other thing is hospitalizations. We are having more positives, but Cliff, are we having more hospitalizations?
No, sir.
Well, we had one, right?
We had one in October.
We haven't had one since then.
And so we're having people test positive, and yet those positive tests are not resulting in hospitalizations like was happening 6, 7, 8 months ago. So people are testing positive, and that can mean other things. Cliff, that can mean that there's residue of the COVID virus in the test. Is that correct? It does. There's positive can mean different things.
Not when you're an elected official, it's either positive or it's not. That's where I'm coming from.
Okay.
We can dance around it and we can try to water it down. I understand what you're saying, and then I do. I know that these people didn't all get sick yesterday. I understand that. But we can't water down what the numbers are telling us. We can't try to wiggle our way out of the fact that we now have 23 positive cases in this county that we didn't have a week ago, or 3 days ago, or yesterday.
Good point. And let me have, I like a rational, calm discussion, and this is good. Also, it makes sense that the more you set an example and the more people see things happening, the more they are concerned. And I think part of the positive increase is more people got tested, period. That's a fact. And I think the more you test, you're going to get more. And I think the more you have people under, we've done, I mean, Mitt brought this up a minute ago, we've probably done a poor job of educating the public. All they're getting their education from right now is people ranting and raving on the radio or on the TV or walking in town and not paying attention, and then they see things happen. I've seen a change. I have seen a change in the town. I see a lot of people who you wouldn't even expect to wear a mask are wearing them. I've seen that happen in the grocery stores. I've seen it happen at these. I see it happening at the gas pumps. And people that care are the ones that are doing it and paying attention. And you can't dictate that. I don't care how many fines you can levy $1 million fine on a guy, unless they understand the big impact that it matters. That's a life and death thing. This is not speeding tickets necessarily or other kinds. So we have to, that's part of this discussion. And I, for sure, and I'm not an advocate, that's just my opinion only, for us as an elected official and we have the legal authority to do this, mandate that you will wear a mask. And you get pushback. I think it's easier for us to make sure we're educating it and doing the examples like you guys are doing now. You got the signs out on the roads, and we need to get it into the businesses. And we at one point even had a discussion where we thought maybe getting people, and this is when we had a task force that we thought could do some things, making signs, putting them in the businesses, helping pass out masks. Even there's a program that we could do to make sure they were wearing the right kind of mask and those kinds of things.
So,
Go ahead.
as of this moment, what did you recommend them happen?
I don't mind having a discussion and understanding why we need to go to red and then go to red. But I'm not I would never vote for imposing a $100 fine and having people start going around trying to enforce that, because we lose that argument. We would lose. Clint would even say that. It doesn't go here, so let's not ask. I'm not worried about that.
Okay, I've heard you folks talk about education, and I think education is something that we can work on.
Well, if they're not educated by now, you're not going to get educated.
Okay, so my question is, how do we bring the business community, which we're talking about enforcing regulations on, how do we bring them to the table to help them have an understanding, as all of us know, that we are spiking?
And I've actually had that thought even through this last week. I think we need to have them sit in a meeting where we're discussing this, because they're in the lives of the area. They need to understand the significance of it. They need to understand the severity in what we're bringing them into to participate in what you did by.
You know, that there are people out there who don't understand what's going on at this day and age. And if they are, do you think you can educate them to change their life? There's no way in the creation of that. We want to pass out all the flyers in the world. But unless there's some teeth behind it, people are going to do whatever the people want to do.
I agree to a point, but that doesn't excuse a small responsibility to try to educate us continually. I agree. How we do that, up for discussion.
But if you had and people can elect not to go, but if you had a large enough room where you could practice social distancing and people would be required to wear a mask, and you brought them in and said, given the situation in Custer County, we would like to have your input on how you can operate your business and meet the requirements of the law.
And I'm not advocating, Jay, bringing everybody in. That I think the leaders of the county, the business owners, the pastors of the churches, the gas station owners, the restaurateurs, because their livelihood depends on them understanding and trying to enforce it, and they would have a better opportunity to do that if they were passing out the masks themselves or taking the responsibility to make sure people were educated that came into their store. Because I'll tell you what, I had somebody remind me in different states and even in here, where's your mask? And it makes you feel, I need to do that for you. So it makes a difference. I appreciate what you put on. I hope so.
So besides continuing, I say continue because I think we've been trying for that, continuing an educational effort, what are we willing to do to slow the spread of COVID down in our county? To me, that's what it boils down to.
Personally, I thought the first step would be to do exactly what we just discussed. Grab hold of it. And within the next 2 days, we could get the primary people that are responsible for the large gatherings. There are people that aren't even coming to town. It doesn't matter so much. But there are people that have to come to town and have to go through town and see the people come and go that need to be and understand what this means and what their responsibility is. Not what they are ordered to do, but what their responsibility is to meet the recommendations that are coming to us, or that we're gonna get. I had that discussion the very first time the first business got shut down in this town. And that was when they decided to shut everybody down and they put the liquor stores on the issue out of the law. The problem was we did that without talking to them and understanding what they were doing now and how could they meet that order with what they had. We can still do that. We need to do that. We need to meet with these guys, the people, and even the school, and have this discussion and help them understand that their responsibility could be what's available to them resource-wise to give to me.
Are we willing to tell people they can't gather personal gatherings at all? Because that's what one of the requirements is for red. No personal gatherings.
Where does it say that? How it says personal gathering size, none. So does that mean you can't go home to your family? You know, what does that really mean? Does it mean campfire? We have to understand that. Are we defining what we think it means? Because that's what we're going to do. It doesn't matter what.
So the red restrictions is for indoor activities. It does not affect outdoor activities.
Right?
It's indoor activities.
So indoor meaning everything except your home.
Indoor business, this is specifically doesn't address home. It's indoor activities and businesses.
If you wanted to have a personal gathering of 15 of your closest friends, that would not be allowed. 3 of your personal friends would not be allowed.
Where in it, you know. But you can't go and there's no way you're going to patrol everybody's home to see if they've invited somebody over. You can't do it. That's why you have to be educating people the impact of them doing that. Just in case one of them's sick and they get your grandmother sick and she dies.
Let me ask you a different question. Are we going to sit here and adopt this red dial and close the restaurants for inside dining?
I'm personally not right now until I get the business owners here to discuss the options. What does that mean? That, you know, can they do home or curbside? How can we help?
They got curbside delivery to go. Outdoor dining. Are we going to say we can no longer serve food indoors?
That's what I meant. Are they willing to go to the curbside in the middle of December or not? What does that mean to that business?
Do you want to ask them if they're okay with it rather than tell them what they want?
I want them to understand.
And you're looking for them to come with you and then you'll approve it, does that what you want?
No.
Well,
I want to understand. Well, first of all, I would like to understand from a technical point of view, what is the risk in this county to having them at some percentage other than none in a restaurant? I know that in some cases in San Francisco, they did it. It's one person can go in and out.
I refuse to get involved with that.
Well, we don't have anything to do with this dial. We either abide by it or we don't.
What are we doing?
You're saying 5 is okay, or 6 is okay. I'm not going there.
Well, we could. And my point is, we can if we want it. If we decide it. If it's to the benefit and it's safe enough, it would depend on the experts. That's why we have the experts. Why do we have experts if we can't listen to them?
Indoor seated events and entertainment. Is that bowling?
Yeah, sure.
Is that going to the theater?
Yeah.
Those will no longer happen if we move to red.
Right.
So,
And to me,
let me ask this question. If that's the case, why bother going? Why do we go back to the other? Why are we following this at all?
see that
Why do we just talk about how dangerous it is?
you could have, you know what, you could.
Tell people how dangerous it is, because if they don't know already, they're so stupid, I don't know what's the matter with them, and they can't figure out that this is a really dangerous thing. So we tell them how dangerous it is again, even though they already know it. We say to them, look, we just had a major spike. Look at our numbers, you know, the going like this for a long time, and it just recently it's done this, gone through the roof, and say, we think you should be more careful. And don't even go to these colors. You know,
But that's the whole point, Jane. They haven't been doing some of the things we could ask them to do and if they understood the difference of keeping in business and keeping our livelihood going, Jane. Because you could have a level of red, for example, and not shut down the business of.
you want to make a pink color.
You could. You could, is my point. Doesn't matter what it is. I agree that they have not. I have not seen any of these guys passing out a mask in their stores. That's a me.
What makes you think changing? What's going to change that?
You don't believe in masks?
How are they? If they refuse to do it to this point, what's going to? How are we going to make them do that? Or how are you going to make them want to do that? I mean, they haven't done it this
Because
good.
when
They
they
know how
see it.
dangerous is it? What, 240,000 people in the United States are dead over this thing? You know, and people are, you're thinking, oh, well, maybe if we tell them that we have 25 more, now that be cautious about, oh, that's not going to happen. I mean, if they haven't done it by now, they're not, at the beginning I agree, because they didn't know. But if they don't know now, they're never going to know.
I see the difference, Dave, when we start. With 23 people now can't go to work. They're sitting at home, wondering how they're going to get their paycheck now for the next week. When they see more of that happening, it would be more inclined for me to tell somebody else, don't come near me when I'm out here sawing my board without a mask. You see, and that's comes with educating them and giving them the opportunity. If you don't, and you turn everybody off because a few people made a mistake and walked by the guy who was sawing his board without his mask, it did that guy out of work. And so that's our job. Is I don't want to see people not get into a position where they can't pay their rent and then commit suicide or get depressed or whatever. Not.
So why have a color at all?
Well, that's right. But this is just nonsense. It's all about. In the beginning, we got a bug out there. What can you do to keep your grandmother from dying and my wife from dying, or me? And the more you see people sitting at home, quarantined, even if they're asymptomatic, it's an issue. So they can't work. So,
From an emergency management concern, we have a problem, a growing problem in Custer County. The clinic last Thursday called me and said they were out of test kits. They had no test kits. So we were not even able to test folks. There's a concern that even when we test people, it's taking 5 to 7 days, Dr. Brown, to get the test results back.
but in Jerry Hyde's case, it was 2 days.
Yeah, instead of 11. So, but the governor, in all respect, the governor has just today put out a new edict, so to speak, requiring that all of these tests, the results, be submitted to the labs electronically, and the labs then come back electronically, not by mail or phone trees or some of the other ridiculous things that have been done. So,
is the test better now? Are they better tests?
no, it's not a better test. It's just a matter of getting information and getting it back.
What time do you need to be?
3:30. Yeah.
Well, I think it boils down to what are we gonna be willing to do, if anything, and what are the ramifications of that?
What can we do for the county employees? Because that's the question that you were all discussing. What can we do with our operations in the county for our essential and non, well, I understand it's bigger, but one thing that you can do immediately is protect your county workers better.
So, I think we should go a little bit. I think we should go to the businesses that would be impacted, one flyer and say, this is what level red means, and stop there. We're not going to enforce it, so what? If they choose to violate it, So at least we, as a management group of the county, did the most responsible thing that we could. I don't agree with that, but that's what it is.
Okay, if you take it one step further, I agree, is that we also have the flexibility if they do the responsible thing, you can take them out of it day after tomorrow. That's by the state operations procedure. And the better we behave, the less restrictions there are. And that's the whole point of the education thing. I think that's a good point.
To say the behavior doesn't mean a thing, it's these numbers that.
That's my point. The numbers go down, Jimmy. If people are wearing their masks and they are getting tested, explain how would you go back to yellow?
Okay,
Not stupid.
let me comment that in other places, they have actually given certificates to businesses. That says this business complies with the state recommendations, they're complying with distancing, complying with masks, that actually have something for the consumer before they walk into the business that says, I'm going to be at least marginally safe here where I'm not. I've talked to people who will not go to a lot of the restaurants here because they don't want to get sick. They don't want to be put under that kind of.
Does that mean in a red condition you could open a restaurant up if you were a very good practice
Well,
practitioner?
yes, if you choose to do that, yes. By issuing a certificate of some kind, they can display publicly, and they could use that as an advertising. I mean, you know, there's
I'm
one
talking about from a state point.
Oh.
We can get a variance to us, or we get our own variance. We authorize that internally as a county to allow
That's
people.
right. And we're given that option.
We're not eligible for any variances right now.
Yeah, I was gonna say, we're way in the water for that.
Why did we advance? We're gonna make up our rules for ourselves.
Well, that's my point. We don't. I used the wrong word. We could grant that a restaurant if it was a case of them really toeing the line, not being like the guys hanging around the bar and ignoring the stuff. You know, when they were at an orange or a yellow vest.
Yeah, we're not eligible, you're absolutely correct, we're not eligible for variance from the state.
Right.
At all.
So it really boiled down from where I said, do we want to abide by the state guidelines, or do we want to do this on our own? I get the sense from Bill, he wants to do it on his own. I'm not totally against that. But I think it's irresponsible for us to say it's our choice, we don't care what the state says. I mean, we can be a maverick county, as Weld County's trying to do. But that doesn't hold any water to me about what's doing right for the
That's
citizens
exactly right.
of our county.
And that's not, when I say that, I'm not advocating going rogue here. I'm advocating us making the choice that's right for us from our point of view. Just because the state analyzed it doesn't mean that their numbers are right and that we've got the ability to modify what we call red. We can do that.
There are businesses within Custer County who are complying with the red standard already. They go above and beyond what is being required to protect their customers and themselves.
And that's why I don't want
And then the tendency is to lump everyone into the same bucket, but there are businesses who are in compliance, and then we take those businesses and we put them in the bucket because there are businesses that are not compliant. So I don't think.
We go to red.
Hmm?
The minority function is that they were red, and we go to red, no change for
Have
them.
an impact.
It has an impact at them. However, what I hear you saying is, what do we do about the businesses that are not following the guidelines whatsoever?
Well, I still think the responsible thing for management of this county is to go to the next level, notify the businesses and the restaurants that that's where we're going. Here's what it means. We expect you to comply, and that's as far as we go. I don't know what else we could do. Yeah, no enforcement.
I would like, personally, to me, how does that impact the
That's
people?
exactly what I just said. We go to red and we have a flyer saying this is what it means to you because we're red. And the bottom line
I
is,
just don't like in-person stuff, that's all.
I'm sorry,
I would rather see us do it with people face to face rather than having somebody hand out a flyer, washing our hands.
I thought that if you want to have a vote on every decision,
No, I don't want that.
that's exactly what you're doing. You're saying, hey, I need your input before I do.
No, that's not what I said. I said, we're gonna go to red, what does that mean? That means I wanna talk to the guys so they understand it, that we're not just some
After we
bureaucrat.
go to red,
And then,
here's what it means. I don't think any business needs to sway me whether we should go to red or not.
that's not,
It is, that's what you're saying, exactly.
no, it's not.
I hear you saying that if that's the decision, then you would like to follow up with some kind of face-to-face to say, this is what we,
And here's why.
here's where we're at.
We expect you to do.
And that's what I expect you to do. I'm fine with that. You want to go for the ahead of time.
Well, right now, we have this period of time right now that we can do exactly that. We don't have to declare red today, we can declare it on Friday, and it's the same impact, it isn't gonna change anything to me, except that you have an opportunity to do exactly that. We're gonna go to red, here's what I want you to say.
Disagree.
That's all I
Heartily, here's why.
PR.
Here's why. Because today, this number came out, 25 new cases. And I agree, I absolutely agree with Mr. Washington that it's not 25, that's it. Yesterday we found out about today, it's far to be 50. I agree with that, it's over a period of time. But the number went up to 25 today. I don't think we have time to wait until Friday or Saturday or Monday or Tuesday. I think we need to take action immediately to show the public we are serious about this. And then we can put it on Facebook, on the county website. If you want to hand out flyers, I'm good with that. You want to get together after we do it, say, here, let me answer some questions for you. If we know the answers to them, and really Dr. Brown and Mr. Washington really need to be the ones to help do that because they know it much better than I do. But we just got a major slap in the face. I am not willing to wait any further till we do something. And I spoke to Dr. Brown about this morning. We probably never put words in anybody's mouth, but Dr. Brown, I feel you agree with me that we probably ought to go to red right now.
He does, I understand that too. That's not, you're just missing my point, and it's okay, I don't care. It's all right. I just happen to think that we owe it to the mayors of these two towns, which were that's where the impact's gonna be, on the businesses that they have, and have them understand, and the people, as we go into that, that's all. We can do it.
None of them are decision makers. The decision makers are sitting here. We make the decision and tell them what impact it is to them.
Right, usually a decision maker listens to everybody's input. And right now, all we listen to is his input, you and me, and all. Right now,
There's sufficient for me with this decision. I am not going to go.
and that's why we're having this discussion.
And it's fine. I don't want to ask them what you think. I don't want to ask the business owners what you
I'm
think.
not telling him what he thinks, I want to tell him, here's what we expect you to do.
After we go to bed.
Well, I don't want to sit here in a position of responsibility for the health and safety of our citizens and not give credence to the fact that I believe that we are in trouble in this county with COVID. I don't want to close the business down, but if we have to shut these businesses down to take out and curbside only, it's a small price to pay for the whole. It's a huge price to pay for the business owners. I get that. Thank God I'm not trying to make my living in the restaurant business. I feel for them. If we think that is the most significant thing we can do to stop the spread of COVID, then that's what we should do, whether we like it or not. If we think moving that school back to virtual learning is the best thing to do for this county, then that's what we should do. I don't know that. I don't have those answers, but I believe that's what the process should look
I
like.
don't know, that's a good question, though. I don't know if we have the authority to shut.
We do, he does.
I don't know.
I do. I looked it up in the state statutes. He has the authority to close businesses and schools. We've gone over this for 7 months. And I don't want to do it. But if we have to, for the safety and the health of the citizens of this county, then we better step up and do our job.
No, I saw the same statute, Tom, not arguing that. I thought there was another nuance to what the superintendent of schools has the authority to do. That's all.
I think that they go directly in chain of command, they go directly from the state.
That's right. And they have to, and they make the same determination that we are going to, whether they open it up, whether they don't, whether they listen to the state or not.
But they do consult. I mean, fair is fair. They really,
I don't want to close the restaurants down, and I don't want to close the schools down. But I will sit right here and say that if we and Dr. Brown feels like that is the necessary action to do, he has the legal authority to do that. That's all I'm saying. I'm not advocating for it. I'm just trying to put it out there, what is fact and what isn't.
I agree.
would you gentlemen allow, if once again, I know that we're never in this situation at all, but I agree with Jay, for me, from just a public, person, I would want to see action, okay? And I would want to see a high level of recommendation, and like you said, we have no team, but we can at least state it and put it on public record and push it from there, and I will do everything that I can. I go from business to business and try to talk to the people and see what we can do. And I would certainly, because I just think it's a positive for people coming into this town, whether they live out in the country or they live in the town or they're coming in from Pueblo or someplace else, to see something that you guys have said, like my third grade teacher, when she was trying to teach us to polish her shoes, Clifford is a clean shoe kid. Something as far as a certificate. Go ahead, sir.
Dr. Brown, I absolutely agree with you. The health and safety of the citizens of this community, we must take action. And we must take action now, today. I agree, if the curve goes down, we go back. But right now, we're in crisis, in my opinion. Okay? The most responsible thing that we can do for the safety and health of the citizens and guests of this county is for us to move to the next level, get the word out, like you're saying, go to the businesses, here's what it means to you. I feel terrible for the restaurants. I don't know what to say.
See, I agree.
Okay, then let's vote.
And if it was the how, only thing I've been arguing all along is the how. And they did a good job of pointing out that it's one thing to say we're going to red and throw a flag on. It's another one to say here's why, here's the important thing. And whether he goes out there or I do or you do in your daily thing, I think that's a good thing for us to do. And that we're going to expect them. I like the point that you made that we expect them to adhere to the recommendations. You can't.
Of course.
So I agree.
And I don't mean to.
That's why we have the debate.
I don't mean to discuss on food vendors, but if we go to them and say, look, this is what red means, this is what our public health director and office of emergency management and the commission, the Board of Health recommend that you do the following, and they do not, that's on them.
Right.
That's all I can say. But we do the
And
response.
that also helps them understand we're making this decision not just from a health point of view, it's also from their livelihood point of view. Is what we're considering. We've discussed it. We still want to see the activities that are out there in the country building the houses to continue, and we've got to keep the businesses that are doing that going. So we look at all sides, and that's the important thing, and that's why we have the discussions before we vote.
So we would entertain the idea of going to the restaurant and saying, we have adopted the guidelines from the state, orange to red. And we have we're asking you to move to take out curbside, and to go orders only.
That's exactly what I'm
Just
suggesting.
you said take out or, you said go take out, not to take it out.
And whoever. I mean, I really like Dr. Brown doing it, although
I will do it, sir.
if he's willing, because he's the director of public health. Here are the guidelines, here's what they need, here's why we're doing it, because everybody already knows this number. Trust me, I can't tell you how many phone calls I've had today already. You know, what are you gonna do, what are you gonna do? But the point is, I don't care what they say, what are you gonna do? I feel my job is the health and safety of the community, we need to take action.
Okay, and I feel the same way even from a livelihood point of view, because it's more than restaurants. We can follow up later, but we need to make sure that ACE continues to do what it's doing. The grocery stores do more than what they're doing, and the Dollar General and that. It doesn't do us any good just to worry about the restaurants.
Retail is half of the
Right.
capacity with increased curbside pickup and delivery.
Right.
It doesn't mean that they can't have people go in their business.
Right, but they need to wear
It
masks.
doesn't impact them.
No, Tom, all I'm trying to point out is that they need to adhere to the mask piece, which they don't, because it does impact you and me. That's my point, so that's why I say we need to touch them.
Instruct them to, but no one's gonna force them to. If someone looks at Dr. Brown and he says, this is what it is, you're supposed to wear a mask, you're supposed to do this, and I go, I'm not doing it. All as he could do is say, I'm very sorry, I'm not willing to worry about your own and the public safety, and walk out. I don't have to, Dr. Brown, if you help anybody,
And it's very important also that people understand that, because we can't have people going, I saw somebody without a mask on, and then calling up Dr. Brown, wasting their time every day. So in the announcement that we make, we gotta make sure people understand what it means. The responsibility is on their back.
Well, I've got a couple of things I want to talk about, and that is human services, road and bridge, and our county offices. If we move to red, we've been moved to red. If we choose to adopt the guidelines, because we've been moved to the red category by the state, then these offices should operate at 10% of their workforce.
Right.
Are we going to recommend that supervisors do that? Are we going to implement that at the county level? As Board of Health, I believe we have the authority to do that. Or are we going to try to stick with the mask and social distancing thing?
Never thought. Let me think. Yes, you can.
I think if we look to red, we are everybody. We don't say myself and expect others not to.
And I just, that's not realistic. I don't think, Jay. I think that's pie in the sky. That's why I'm frustrated.
Wait.
To me, it's a little more black and white than where Bill's coming from. If we move to red, then by God, there's the guidelines. That's it. If you don't have the nerve and the intestinal fortitude to do that, then let's not adopt what the state tells us we should be doing. I don't have the intestinal fortitude to trim this county building down to 10% of its workforce.
I do.
Well, let me ask, let's before you go either way, one way or the other, what does 10% mean? Started down that path a minute ago.
Well, there's 27 people working this courthouse, so now there's 3 people running this county building. That's what it means to me.
That's not what it means to me. You know, if we look at capacity.
Not talking about capacity, Bill, we're talking about employees. It has nothing to do with capacity. A number of
That's your
people working
definition,
in
Tom, that's not what that, I don't believe, this is my
Wow.
opinion,
Okay.
would go down to 10% capacity. It's, what can that room physically handle when at 10%, what does that mean? How many people is it really? And that takes a little bit of effort and analysis, a measurement of the room, and to figure out of the 27 people here, how many could stay in the clerk's office?
I just personally
I think the clerk's office could handle 2 people without breaking any social distancing or safety or anything like that. That's a fact. So that, you know,
be 90% of the workforce.
Well, see, that's why it's not practical. We can define that, I think. We can get real about it. The treasurer's office has one person in it most of the time. You're gonna boot her out because she's automatically 10% already? No. Treasurer's office could stay open.
Could.
So that's free there. And then, you take a look at the health and human resources. 2 people in there in that big room, probably. That cuts us down, and that's our definition and actual capacity. The building even more than that.
I think the ramification would be that the services that we provide would be significantly diminished. But considering what is happening with COVID, that may be a necessity.
That's okay.
And if your road doesn't get plowed as often as you want it to, I'm sorry, we're following the COVID guidelines.
Let's take the practical things that you can probably plow the road with just one guy and a grader. Unless you're going to say one guy's 10% of his whole office space and you can't go to work anymore. That would be impractical.
I'm not saying shut it down.
I know. But I think we made that mistake earlier. We don't need to shut the road and bridge down.
I think it was a mistake.
Well, we made a decision, and that was maybe not the wisest one.
Well,
We spent taxpayers' money sending everybody home on paid leave.
May I make this suggestion?
Let's get back to the office first.
But
Go ahead.
you have essential employees and non-essential employees. And so these rules apply to primarily the non-essential employees, and it recommends that those non-essential employees work, but they work, as Tom, I believe he said, from remote locations.
If possible.
Well, for most of us, it's
We
possible.
the clerk's office can't take anybody remotely, according to what they told me, because these computers are hooked to a special system, they can't take them home. So, you could,
So each of the
take it on a
managers,
case-by-case basis.
but each of the managers would be different, and what was recommended, I asked a couple of questions coming to this meeting, is who are our essential employees? For example, the road and bridge employees would be considered essential employees, especially this time of the year. They are working for the most part, other than the mechanics, they are working in a remote, outdoors environment. So there doesn't need to be a limit on the number of graders, for example, that are out plowing roads, because their office is that grader, and they're moving. So road and bridge would be a different situation, but you have to, like the sheriff's office, it's all essential, so this rule is totally different for the sheriff's office. I am an essential employee, so that would apply to me differently. Dr. Brown's office is essential, so the rules would apply somewhat differently for his office.
You make a good point. So let's take it a step further. You could make a case that none of the county employees in this building are essential. If you could. But we have essential services. If we care about keeping the county livelihood going, of people that are going to be outside getting permits. So if we just declare that.
I can think of the sheriff's office.
Is an essential service. How many people meet the criteria for the 10% piece that they pay? The assessor, I don't know. Maybe you can make a case for, maybe we need to look at that separately. The treasurer's office probably is essential. Human services, I think, are, but what's the minimum? That would be the department head's job to get us down to the 10% in the building. And some of those people can do their work from home. So do we look at it on a case-by-case basis and meet the intent of this so that we are meeting the significant safety factors for the COVID issue? But we've got services we want to continue to provide to the county, I believe.
So if you move to go to red, would you give Dr. Brown's office and my office an opportunity to come back and tell you what that means so that we could present a plan for what it means for the county, what it means for the community.
The whole thing, because
If you move today to go to red, could you give us a little bit of time, a couple days, to come up with a plan as to what that means and to present that?
Well, kind of going at it backwards,
a bad idea.
I get where Jay's coming from. I think we need to do something. I don't think us voting today is gonna change a damn thing.
That's the perception with the public that we're trying to
I agree.
take action.
Okay? Exactly. Not that we're gonna be effective, but at least we did something. I get that.
I honestly feel without, I don't mean to interrupt you, but I honestly feel without enforcement, we're not gonna be effective regardless. But we've done the right honorable thing, and that's what the
Right.
county needs to
I
do.
agree. And this next step, I like what Adrian just suggested, because we can waste more time. You need to go to a meeting, but we can come up with what is the footprint for the county employees and the county residents. What should it be? Provide the right services. And then we could consider the road and bridge, or maybe a couple of people over there that could be.
Adrian is absolutely correct. We need to have a plan, because we're not a restaurant that has
That's right.
5 employees, we say 2, you have to come,
Right.
or whatever the number is. I agree, we're a different animal. Some of us is essential, some of us is not. And so, I have no issue with that. I think it's a very good
I think
suggestion,
that's a good suggestion.
but I think we need to take action.
So,
Well, I'm gonna continue to look at it from the perspective of whatever we do, or whatever we talk about or argue about. To me, the final analysis is it going to improve the health and safety of our citizens? If leaving everybody in the county building doesn't have an impact on that, then I'm fine with leaving. I can tell you this, we have county employees in this building who absolutely do not feel they should be here because of COVID.
I mean, that's right, that's why.
And if we don't address that, we're gonna have some
I
issues.
agree. And we should. So, that,
Adrian offered to do that.
right. I think that's a good idea.
I had this discussion with Dr. Morrison last night, about an hour, relative to what is actually essential to keep goods and services and so on going, but even more than that, for instance, the road and bridge. If we don't have those roads plowed, and the guy's liver goes down, his kidneys go down, whatever, that all of
Or
a
from
sudden,
any other disease, is that right?
anything, I'm just giving examples, of course, but that immediately becomes a serious, serious health issue.
Well, I think we should consider doing something with human services. That is such an enclosed office. I personally think those ladies should be working remotely.
I did talk with Stacy last night, and I had a conversation with Laura earlier. There's a lot of things they can do that they can't do in the clerk's office. And they're probably, and they did say somebody needs to be there to answer the phone, because that's where they call. They're not going to call somebody's home number because they got a social service issue going on.
Can you not ring their number over to?
You may be able to do that in some cases. Not everybody has good phone.
I'll be honest with you, gentlemen, I think maybe it doesn't have any impact. If it doesn't, then I'll certainly reconsider. I think we should close down these offices to 50% of the people that are in there right now. I don't care about the services. I think the health and safety of this county trumps providing services, because those can wait. We've got to put a finger in this dam, or I'm afraid these numbers are going to continue to climb, and then they'll be out of control. I don't think there's an office in this county building that can't operate at least, at the most, 50% capacity.
I don't have a problem with it. But that's, probably. But let's, all right, I want, any other discussion?
Well, my problem with that is, I'm not sure about our authority to tell elected officials what to do.
Where I was headed with it, and I talked to them last night, I think it's their job to consider have a recommendation.
Honestly,
I think we can.
State King has the authority to do that.
Well, that's the point, Tom. That is us. The Board of Health, the public health agency is the agency itself. And we're the decision maker. And I know that they, elected officials are expecting, but I think it's their job to tell us what they can do to maintain the business, not ours. If we think 50% or
But again,
capacity is
Tom, I agree with all of what you're saying, but I think that as a Board of Health, we have to make the decision to go to that. And then as the VOCC, you set your policy.
not the BOCC, it's the Board of Health.
But no, by saying as the Board of Health, you make the recommendation to go to red. How that plays out in the county administration building is a decision for the VOCC.
Yes.
although I'm not sure we can tell an elected official.
You probably,
I think.
but he can
What he can do is give the guidance to the elected officials.
So I think it's telling what it
Well,
was.
that's what I meant, tell him.
He has the authority to say, you will do the following.
That's what I said.
Now, whether I do it or not, it's like telling a restaurant.
I called it things.
So, and I know we're gonna make I got 10 more minutes, but I'd like to, I mean, we've kind of run around in circles on this a whole lot. So, I think the first question we want to have is, do we feel that this is the appropriate time to move to manage kids? And if it is, we could implement the suggestion that Dr. Brown has about notifying the businesses what's required and what they're supposed to do.
And then we can work the suggestion that Adrian.
Adrian's gonna work on what they are here, but I really like
That would be a,
Tom's suggestion too. It's just,
well, what Tom, it plays into what Tom suggested is, what are the numbers? And then that would be a VOCC, workforce issue to meet the requirements of the rain conditions. Isn't that two steps?
yeah, but I think, I don't think we, except for Dr. Brown, have the authority to demand, and I'm saying that in quotes, that any elected official's office be cut or whatever. No, I think Dr. Brown has that right, I don't think we do. So,
No, I think you misunderstand what I'm saying. He has the authority to say, look, 50%, can you do it safely at 50% or 10% or whatever that,
what if we say, no, I need everybody here?
then he's gonna, well, his call, is that gonna be safe or not? And then that's the VOCC can say, all right, we're just gonna shut that office down, we can't meet it.
See, we're in the same position as elected officials, we can't just shut people down.
That elected official.
Yeah, I don't know that 50% is a magic number, but I think the offices can still function. To me, it's boiled down to countywide now, not countywide, but the county building. It's either boiled down to we shut this building down again,
Right.
or we do something different than we're doing right now.
We tear it down.
Right.
We've just been very lucky that we've had 2 positive cases out of this county building and not 12 or 15.
And I'm very scared, considering a very close-knit office over on the other side, that we may not see a spike over there. I hope I'm wrong, but I'm concerned.
Yeah, I think it's.
And I think Adrian came up with exactly the right plan for this county. Let them look at it, come back and say to us, let's do
I
it.
agree.
One other thought I want to throw out, and I'm guilty of this. I was called on it yesterday. For some reason, I got this mental thing that I keep looking at the DHS office as an elected office. It's not.
No, it's not.
I think we should send those folks home and have them work remotely. And then I think we should have a serious conversation about limiting every other office in this courthouse to no more than 50% of their workforce.
But let's get them out of that.
I'm good with what you said, but whether the number's 50% or not,
That's debatable.
let's let Adrian tell us.
I agree. Well, it's working people. And as far as the DHS goes, I agree. I would like to have Laura or Stacy recommend what they need. If it's one person, there's no reason to throw everybody out there. If it's one person,
True,
they
they
got
can
answers
work
on.
one person in there.
Sure.
The more people we have in the building, the greater our chance of spread's gonna be. I agree, I could go along with one person in there.
Sure.
But to have 5 people in that office
you don't
as
need
closed
that.
up as it is, I just don't think it's safe. They might need it, I'm not arguing about what the need is, I'm just saying I don't think it's safe.
Well, I think they can do that remotely. There's people that have to be sent out to people.
Even if they can't. And some people don't get services that they demand.
On the end of the world.
We're in a very unusual, terrible time to say, I'm very sorry, but circumstances are that we cannot
I agree.
take care of your issue at this moment.
And that's why it's important to let,
Safety of those people is first.
yes, but Stacy reminded me last night, there are critical, there's life and death issues that have to be tended to, but we would not shut that office clear down.
I'm not sure.
And that's well, we gotta be careful.
Well, that's my recommendation. I would ask Dr. Brown to have that conversation with Human Services. I just think we need to get those folks out of that office or we're going to end up in trouble. That's my worry. And I think we have to do something. I think looking at reducing the number of people that work in this county building is doing something.
And so, it's a zero motion.
May I make a motion?
You may.
I move that effective immediately, this county adopts the state recommendation of level red, and we authorize or request that Dr. Brown notify the businesses what that means and asks for their compliance, not demand it, asks for compliance once they understand what's necessary. And, is all part of the same motion, we enlist Mr. Washington to come up with a plan on how to tear down the county building with major emphasis on DHS. How's that for a short, succinct motion?
Today, when I didn't get that.
I don't know that last part, it's the county offices and DHS goes.
The DHS is very concerning to me, actually.
Well as IT, human resource, finance, and zoning. Now, that's a freaking petri dish over there. So, we're just being super lucky. They're not mask wearers.
But now they can restrict people coming in and out of those two offices. So that zoning has.
I would second the motion.
Okay, let's hear some discussion. One thing I would ask is, Charles Bowl brought up to me today after the meeting during it, that there's some 400 and some odd businesses in this county. And so I think you need to get with them and find out which ones. There's a lot of little mom and pop ones sometimes they're working out on. There might be some businesses that would need your attention that are beyond what we're talking about.
Yeah, I'm thinking about Dr. Brown would meet with the businesses that customers that come in to them.
Brick and mortar,
maybe,
Restaurants, but the mom and pops, I'm not worried about the print shop up there.
no, I think we're a little more
That's why.
critical than that. That number is inflated because a lot of home occupations are included in that. Well, that has no bearing on this conversation.
So we want to make sure we handle the mortar. There's some businesses that are out in Cypress, the area that you don't even know.
They try to come around with the right thing and find who he needs to speak with and make his own determination whether I need to discuss it with him or not.
You want to try repeating that back?
No,
Like you're trying to say.
I'm literally gonna take it off the floor so I get it right.
Another point of discussion then on this motion is that today is Wednesday. I have no problem with these gentlemen doing their job, but we're going to have to meet again, I think, before the end of the week, or certainly before the end of the weekend.
I'll have your plan, buddy. Close the business on Thursday.
how about we meet before 10:30? How about we meet before 10:30 on Friday?
That'd be good for me, because that's when my meeting is on Thursday, but I don't know when yet. So if you,
At 9 o'clock, I mean, that was what we originally discussed before we went this night over.
You're talking about on the 4th,
How about this Friday?
December the 4th?
Yes, because we have a very important event coming up at 10:30.
Well, and I was gonna go just the opposite direction. I was gonna say maybe later in the day to give detail on the time.
Yeah, I would agree too. I would rather do it.
Maybe 2 o'clock on Friday.
Um, uh, 2 o'clock.
3, 4.
Let's do it 3 o'clock. 3 o'clock.
Is it necessary to do it Friday, or can we do it first thing Monday morning?
Do it first thing Monday morning.
That's 5 days from now. That's a little spooky.
Well, they're gonna change anything though on Friday night. Nobody's gonna be in the building.
No, but if we vote on their recommendations,
No, but we can turn them loose even if
I'm not doing that because we need something, but I really, I
it
think,
seems like what else has happened Monday? There's another meeting.
I just think we're gonna make substantial changes to the county building specifically. If we could let them know by Friday and then take effect on Monday, it would be quote unquote a little fair.
Friday,
Yeah, but,
they're already going home at 4 o'clock.
so I think, I still think that probably Monday would be okay. It gives you a chance to work with the directors of each office.
The employers can have to come in.
They gotta come in, they do their thing, they gotta get their equipment, get their stuff. I think that's fair.
Yeah,
Probably even
that's
better.
fine. I'm not gonna die on this sword. I'll go on whatever.
I think
I
that's
just
probably
think
good.
these guys need to have a little time to function.
I do too.
Because this isn't the only crap.
There's something going on Monday. I threw my phone in the trash right away.
And then,
My phone doesn't.
what are we gonna do about Road and Bridge? We're gonna let them do their own thing down there? Clifford, what's your recommendation to their supervisor?
well, their supervisor right now is, incapacitated. He can work from home, but not with anybody else. He's not symptomatic or anything like that, so,
And I'll talk with Gary Cliff. I can talk with Gary and have him come up with a plan.
And I did talk to Gary earlier, it was a couple days ago about that issue when Scotty was out and other things were happening. And he said they only have that one meeting in the morning, their morning roundup, that doesn't need to be all in person. And he needs to work through Hyde with get the plan out. So, but that's something you could work with him, because it's an open air, it's in a big building. If they stood 20 feet apart and yelled at each other, that's probably okay. But it's up to you. Okay.
And we leave the school like it is, huh?
I don't think we're gonna be able to put masks on all those kids. And essentially, that's about the only option we have unless we go totally virtual.
Yeah, there's school districts all over the United
We're doing
States
that.
that require their students to wear masks. So
We just,
I'm not trying to get up in their business. I'm concerned about that being our next big serious.
You could have a discussion with Mike and have this talk, and we could get together. All right, so the motion is to go red and to get a plan to implement that. Basically, and we'll finalize that plan on Monday. And a good time to do that would be in the morning sometime that we don't. So why don't we could pick a time, let's pick 10 o'clock for now, and let's coordinate and see if everybody can make that. If they can't, then move it. And we got time to adjust after 4 days. So I'm not sure what I got. I know there's a meeting I got roped into.
Before you leave, I need to talk to you about the RFP on the bid request you sent out today.
Oh, okay.
Yeah, my calendar's pretty open on Monday.
I know I have.
I'll do it at 10 o'clock.
Let's do it 10 for now until I get the chance to actually look at the meeting. I think it's a Mullen meeting. Remember, it was him getting with Trent, what's his fuss. So, I think it was, I don't know, too late now. I think 10 o'clock is fine.
Look real quick and see if we have what.
Yeah, as soon as you do, take a vote, because Jay's got to leave in 2.5 minutes.
I'm sorry,
Right.
if I had a phone number to get out of this meeting, I would do it, because what we're doing here is an absolute utmost important, and this is my primary job. Unfortunately, it's a commitment I made, and I apologize for that. And I know, that's why I suggested you want to talk to this one.
I had to make a,
I understand what you want. You got to, you don't have it. But I think we beat this to death. I think we're
Right.
going to agree with
let's call for the vote. All in favor of the motion as presented, I'm not going to repeat. So say aye, Jay.
Aye.
Tom.
Aye.
Candace, aye.
So, we'll get Brian to put out notice and we'll start implementing them.
And so do we have any moral obligation to do some of the legwork here?
Absolutely, I'm happy to do what I need to do.
We can divide up the businesses, I don't know.
I'm going to call 2 mayors just because I didn't deal with them.
I would feel comfortable if either one of you said, hey, we need some help here, can you do this? I'll be more than happy to do
More
that.
than happy to do that.
Thursday is not happening for me, I'll be in a meeting all day.
Thursday, I'm going
Mr. Cannon will be in that same meeting from 11 to 11:35.
That would have been.
Yeah, that extension.
We did good.
Could you, Tom, contact the managers and maybe schedule a meeting for tomorrow at 10 o'clock?
You talking about
The
in
managers?
here,
Yes.
supervisors and elected officials?
Yes. And then we could get together in a neutral spot, a large
I
spot.
think you need to pick OEM building.
Here.
No, we can do it in the courtroom, they're closed.
You can do it in the
Yeah,
courtroom.
if we could have the meeting, then we could get all the managers in one room and come up with a
Who's
plan.
the we? You and
Well,
Cliff.
you assigned Cliff and I to do
Right.
it, so we'll take care of it, but I have no authority to tell the manager to come to a meeting.
Tomorrow,
10 o'clock in the,
Work with you.
and this,
well, I don't know what their schedule is in the morning, they're closed in the afternoons.
Easy answer would be to have them work with him to get the time for an evening.
well, I just believe in setting a time, so if you just
Well, I
set,
do too, I just,
set a time, and we can meet at Lane Hall, call up.
we can't go ask them because they're gone.
Yes.
So if we want it in the courtroom, it'd have to be in the afternoon guaranteed. If we put it in the morning, there's a chance they're gonna have something going on in there.
Would you be comfortable with having this come over to the SARS building?
Probably not, because I don't think they're gonna wanna be out of their offices or be away from their offices. I think you should maybe get by with this meeting in the basement.
Why don't you, work with them? All Tom has to do is just tell me you're gonna schedule a meeting.
I don't like to schedule.
It'll be working with you.
I don't wanna
I think
miss a
he's
whole.
probably over there. Do you think you'll ask
That's
her?
what I'm saying.
It could, yeah. I'll be worth going and looking.
Yeah, I think she
If she's still there.
We could use the
That's
building.
only for them.
I think either the courtroom or the basement. Because I know Kelly's probably not gonna wanna go off campus.
Okay.
JD, I don't think he's even back yet, but I suspect he's in 14-day quarantine, right? His wife came up positive now that we're not recording.
But I can talk to him on the phone if necessary.
So I agree, I think it'd be nice to get everybody together. I just,
But that's up to you. We just told you you could do it.
well, he's asking if I can help him
All you,
facilitate
right,
doing
all
it.
you can do is,
That's my point.
you need to take a time.
I need to check something here while we're talking about that.
Good, so I'll get together with them in the morning
Okay.
and take care of the county building. This is totally different, and then, we can pull your team together and ask for some recommendations on the education bulletin.
Yeah,
But not only that, but also
Nobody around?
the impact on the essential workers, the definition.
Yeah.
We need to have, keep things safe.
If we, just a thought, gentlemen, if we could come up with a single sheet of paper that said, here's our recommendations while we're under red.
Okay.
For whatever you guys think that looks like for a restaurant, then we could help you take those around and say, you may not know, but we're now been moved to red. These are the recommendations we've adopted. This is what I like the word, this is what we're expecting you to do.
That's all we can do.
Yeah, that's right. I like when Bill said, expect. That's what we expect.
Right.
Now, I don't, everybody knows this already. Everyone knows this already.
Well, they need to understand what they're.
People on Facebook are screaming for somebody to do something. That's the other side of that coin. So, but I'll, like I say, tomorrow, I've got this underfunded court commission annual meeting all day long. So, Bill presenting at 11 for that. Later in the day, I think, after 4, I could help take stuff to businesses or whatever, I don't know. It's not fair to just say, we sit up here to make all the rules and tell you guys to go do it. You don't have enough manpower for that.
Correct.
So,
Not that deal.
Okay, we'll get things done.
you got a new storage building out here.
Okay.
We do.
Pretty much.
You're ready to adjourn? Meeting adjourned.
Thank you.